this is just gonna be like a chill talking video. Um, so my name is Sam. I also go by Sammy. Um, I was born with cerebral palsy, but this is not what this video is about, or the videos that will come after. Um, for the past 4 months, I've been kind of living through this crazy journey with a mystery diagnosis. So on Halloween, I thought it was any normal day. I woke up, I got ready for work. Halfway to work, I noticed I was feeling a pins and needles sensation from my knees down. And I thought it was weird because I wasn't sitting in a position that would cut off my circulation to cause that. And I was just like, okay, maybe once I get off the bus, because I have to take special transportation to get to and from work, and I walk around, I'll get the feeling back. That didn't happen. I remember I got off the bus, and there's benches out front where I work, and since transportation gets me there way earlier than I'm supposed to actually be there, which has to be that way because you don't want to be late. I sat there and I'm like, something's not right. And I started to get worried, and I'm like, do I call my boss? Do I call out? Do I go home? Do I go to the hospital? Like, what is going on? But then I talked myself into going inside and deciding to just do my day because I was there already. My home is like 30 minutes away from my job, so it's like, okay, if I just bail right now, I'm gonna have to pay like $25 for an Uber to just go home. To do what? So I went into work. By the time I got upstairs, which is maybe for me 5 minutes, because to go through the elevators, I have to maneuver the doors and get to my area, which is quite of a walk. So by the time I got to my area, the pins and needles sensation started in my face, on my left side of my face. And I'm like, okay, this is not normal, and you need to tell someone. So I pulled my boss aside and I was like, hey, I may not be coming to work tomorrow. I think I have to go to the ER after my shift tonight. Something weird's going on. And she asked me, like, what's going on? So I told her, I'm like, this is what I'm feeling. And she's like, Sam, that's not normal. You need to go to the ER. And I'm like, well, what about my shift? And she's like, don't worry about your shift. We'll work out your times after. Just go and go now. So I got into an Uber, went to the closest ER, thinking they were just going to give me pain reliever and tell me to go back to work. That didn't happen. By the time I got to the hospital, which was maybe 15 minutes, the pins and needles traveled all the way to my hips. So to just give you like a timetable on this, back pain started at like 10. I noticed by like 11 the pins and needle sensation. By the time I got to the hospital, it was 1 p.m. So they were progressing pretty fast. So they brought me into an area to assess me. They decided, since it was obviously something with my nerves, they were going to have to do a MRI of my spine. A 3-hour MRI of my spine. Now, no one wants to sit through tests, especially tests that could possibly tell you you're either very ill or, worst case scenario, you're going to die of something. So that's scary. And I also have a hearing disorder. It's called hyperacusis. Basically, how I hear, it's different the way you hear. So all sounds sound louder to me. I hear them at different pitches and different frequencies, and it actually hurts my ears and it causes so many issues. So when I'm in an environment that I can't handle the sound, I wear these. They're noise canceling headphones, usually worn by construction workers. It helps, doesn't block out the sound completely, but it's better than nothing. Problem is, they have metal, so you can't go into an MRI machine with that. So that was nerve-wracking, but I knew I had to do it to figure out what was going on. So I did the 3-hour MRI. I did the CT scan, and then they told me that they were going to admit me. That's when I knew, like, okay, this is like serious. Like, they're admitting me now. I'm not going home. So, I contact my boss, let her know, contacted a friend that was nearby because I have a cat. So I wanted to make sure he was taken care of and fed and all that. Because by this point, it was already almost 8 o'clock at night. So they put me in a room. It was like a really small room. My friend kind of pushed the nursing staff to put me in a bigger room. And the nursing staff agreed because they can barely get their machines around the bed to get to me. Like, honestly, I don't think that space was meant to be a room. I think it was a storage room that they converted into a room that they shouldn't have converted into a room. Whatever. So the next day I was moved to a bigger room. And things progressed. My pain symptoms got worse. The pins and needles was full blown on this side of my face. I was feeling it from head to toe. No one knew what was going on. So what happens in this scenario? We're going to pull out all our diagnostic tools and drain you of your blood, take other fluids, and try to figure out what's wrong, along with more tests. So they did another CT, they did another MRI of just my neck. Still couldn't figure out what was wrong, so they had to do what they call a lumbar puncture. So a needle goes into your spine and extracts your spinal fluid to find if there's any abnormalities. One of the major abnormalities that they're looking for is multiple sclerosis. So we had to wait, I think it was 2 to 3 days for the results. Didn't show signs of multiple sclerosis, which was great. But something was there, they just didn't know what, and they didn't know what was causing it, which doesn't help the situation. So what do? They take more blood and take more fluids and load me up with meds. The neurologist thought, okay, her pre-existing condition is cerebral palsy. If I don't know what this mystery diagnosis is, I want to at least help her with her CP side of things. So cerebral palsy causes muscle spasms. There's 4 different types of cerebral palsy. I have spastic diplegia, so it mostly affects my legs, and I will sometimes have a jerky movement, or the spasm will be more of a, well, obviously all spasms are internal, but the way I'm describing it is it's an internal shock, and it hurts. So neuro decided, okay, we're gonna help with the spasms because this other thing is causing her so much pain, but what the spasms are doing is they're causing my body to contort on itself, causing more pain. So they decided to give me a muscle relaxer called baclofen. Baclofen is a med that's usually given to CP patients. It is the only muscle relaxer that can work for CP patients. We cannot have any substitutes like Flexerol. Like, it has to be baclofen. I took baclofen in high school. It was a very low dose. I think it was like 5 or 10 milligrams. When you first take it, you have to like ride through the symptoms. It's going to make you really sleepy. That lasted maybe like 2 months before my aunt like was, this isn't working, you're falling asleep in class, take her off the med. So that's what we did. So basically I've been on and off baclofen since 16, all through adulthood. It got to a point where I actually had to stop taking it. I want to say like 4 to 6 months before all this happened, because the insurance wouldn't cover it anymore. So I knew what I was getting into, but because the spasms were so bad, they had to put me on a higher dose. So I'm expecting, oh, I'm gonna knock out, no. They put me on 30 milligrams at first, did nothing. We got to, I think, like my 6th day in the hospital. Neuro was like, okay, oral baclofen is not working, so you are a perfect candidate for the baclofen pump. It's just a different way to administer the drug. A pump goes inside of your abdomen, and there is a catheter that wraps around and goes directly into your spine. Supposedly is going to work better. One of the first steps in that process is you have to be on the maximum amount of the oral drug, which typically for hospitals is 80 milligrams, which breaks down to 20 milligrams 4 times a day. So they did that, and I did not have any adverse effects. I've been on the maximum of the oral drug since then, and we're now almost in the end of February. So they did that. They had to give me like Percocet for the pain. Weird things were going on. I kept feeling like a tugging sensation in my head, which I later found out from another neurologist that's just like a tension headache, and that's caused by like all the nerve issues that I'm experiencing. I had issues with vision loss. Found out later from some physical therapists that if your nerves are being compressed or pressed in your optic nerve, it can cause those issues. So all these fun things and no reason why. So I spent 9 days in that hospital. Majority of that time was spent in a diaper and using a bedpan because the pain was so bad, and nursing staff thought it was best for my personal safety to not use the restroom. So what happens after that? Hey guys, so it's featuring me editing this, and I realized that as of right now, I can only upload videos that are 15 minutes long. So this video had to be cut in half. So if you want to keep finding out what's going on with my mystery diagnosis and the rest of this crazy journey I've been on, please watch part 2 of this video.